Hi, good morning Vincent. My name is Lisa Brown. I'm your invigilator for the OET speaking session on the 8th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Vincent Grouse.
And what is your candidate number, please?
My candidate number is 276349193.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What did you like least about your last job?
There was nothing I really hated. Sometimes, we would be a little short of nurses on the unit, and I remember a couple of nurses were not pulling their weight as much as they could. As a result of having to bear the additional burden, my responsibilities were a bit more taxing than they should have been. After about 6 months of this, I was beginning to feel a bit worn out and worried that I wasn't giving my patients the care they deserved. So, that was a little vexing. But, as I already said, I never disliked or resented my work.
When were you the happiest in your job?
I feel satisfied while talking to the patients and making them feel comfortable. I'm happy when I know I'm doing a good job for them and giving them the greatest care possible. When a patient appreciates me or smiles at me, it brightens my day. I think this attitude shows in the way I have been reviewed and rated so highly in my peer reviews. One of the reasons I would like to work for the hospital is that I will have even more interaction with patients on a more critical level.
What do you feel you contribute to your patients?
I provide all of my patients with the very best care and advocacy that I can. It's important for me to ensure that my patients are always comfortable and are confident in my abilities, so they know they are being looked after properly. Also, I will act as their advocate if necessary, and give a voice to any concerns they may have about their treatment.
Have you ever had any differences with nurses you have worked with?
I once worked with a nurse on a pediatrics ward, and we simply didn't get on with each other. It was just a clash of personalities. After about 3 months, it was becoming almost impossible for us to work together. So, finally, I pulled her aside and asked her to have a quick coffee after work and find out what was wrong. It turned out she was just communicating differently with nurses in her unit in the past. After we talked about this for about 15 minutes, we actually began laughing at what we both perceived to be slighted on each other. We ended up working it out, and we're very good friends now, believe it or not.
How do you feel about coworkers and supervisors who come to work late, leave early, or take long breaks?
That is unacceptable to me. To run the institution and ensure the patient's well-being, we must all work together as a team. I would not put up with other nurses or supervisors arriving late, leaving early, or taking extended breaks during working hours. The sooner we can get everyone started on their given shifts, the better it will be for everyone.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Vincent Grouse. I am one of the nurses in the community health center. For the purpose of record, may I know your name, please?
Good morning. My name is Lisa Brown.
Hello, Lisa. How may I help you today?
My mother is 80 years old. When she had her 3 monthly routine checkups, the doctor said her cholesterol level was fairly high.
Okay.
So, the purpose of my visit is to learn more about cholesterol and how best to reduce it.
I appreciate your willingness to gain knowledge about your mother's condition. Before proceeding further, may I know your understanding about cholesterol, please?
I am totally unaware of the condition. That is the reason why I am visiting the health center. Please educate me.
No worries. I am glad to explain it to you. Lisa, first I will explain what is cholesterol.
Okay.
Cholesterol is a waxy, fat-like substance that's found in all the cells in the body.
Okay.
Mainly, it is the liver that makes cholesterol. Along with the liver, some foods, such as meat and dairy products, also contribute to cholesterol buildup.
All right.
When that being said, our body needs some cholesterol to work properly. However, too much cholesterol in the blood is not good for health and can have higher risks.
Oh, I see.
Now, you know cholesterol is needed, and, if the level increases, it's bad. So, I will guide you on the types of cholesterol.
You may please.
Namely, high-density lipoproteins, HDL, is good, and it helps to remove cholesterol from your arteries.
Okay.
The other being, low-density lipoproteins, LDL, is bad, and is the main source of cholesterol buildup and blockage in the arteries.
Oh, all right.
Minor increase in the cholesterol level can be controlled by the change in diet, and also can be treated with medication. Nevertheless, neglecting the cholesterol level can cause an emergency situation. That is, in the long term, if the fatty deposits are lodged in the arteries, this can lead to heart disease or stroke.
Oh, is it? Nurse, then what the doctor meant by a fairly high level of cholesterol for my mother?
Your question is quite reasonable. What the doctor meant by a fairly high level of cholesterol is that it is elevated above 5.5 millimoles per liter in the blood. For better understanding, I will explain it to you. Please pay attention to me.
Sure, I will.
The total blood cholesterol level in human blood can vary from 3.6 millimoles per liter to 7.8 millimoles per liter. Even so, the target cholesterol level should be under 5 millimoles per liter.
Okay.
Any reading over 6 millimoles per liter is high, and significantly raises the risk of disease. I hope it is clear to you.
Yes, I got it. But nurse, what do you consider my mother's cholesterol level should be?
I understand your concern, Lisa. Don't panic. The recommended cholesterol level should be under 5 millimoles per liter. In your mother's case, it is very fairly elevated to 5.5 millimoles per liter in the blood, which can be managed and brought into the suggested level.
Good to hear that, nurse. Well, I need your advice about what my mother should do to lower her cholesterol level.
Definitely, I can help you with that. To best deal with her cholesterol, a change in diet pattern is the most recommended solution.
Okay.
Avoid saturated fats and artificial trans fats. Trans fats occur naturally in red meat and dairy products, whereas the main source of artificial trans fat is from restaurants and processed foods.
Okay, I will take care of it.
That's good. And let your mother eat more fiber-rich food, enjoy lots of fruits and vegetables. Eating fruits and vegetables is an easy way to lower LDL cholesterol levels.
Okay.
I will provide a leaflet, which contains detailed information about the cholesterol diet food.
That's wonderful. Thank you.
Thank you for accepting my suggestions. I hope I have helped you today. Feel free for further queries.
That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.